And it can be really hard to give up on the dreams and the expectations of the birth and the delivery that you were hoping for and the term baby that you were expecting. Hi everybody, welcome back to my channel. My name is Elizabeth, also known as Nurse Zabe here on YouTube, TikTok, and Instagram, and I am a labor and delivery nurse, postpartum nurse, certified childbirth educator, and mom to 3. And today's video is actually going to be one that was requested by you guys. It is going to be another reaction video to a TV show where the character has a baby. We are going to react to Beau's birth on Blackish. And this episode is actually going to deal with so much more than just birth like our other reaction videos have dealt with. In this, we're actually going to be talking about preterm birth and also preeclampsia. If either of those things feel like triggers for you or things that you don't want to watch, totally fine to skip this one. But I think that this video is really important for us to talk about and to talk about the signs and symptoms of preeclampsia and what a preterm birth might look like for you in the hospital, because it happens. It happens to some of us, and often it's maybe not super expected, just like it was for Beau. This kind of came out of left field for her. With her 5th child, it was not what she was expecting at all. Definitely go ahead and thumbs up this video. Comment if you have any other reaction videos you'd like to see or anything you'd like to chat with me about in the comments. I'd love to chat with you. And subscribe, share this video, all those good things that help with the algorithm. And let's go ahead and jump into it.
Leslie and John are having a co-ed baby shower. Look.
So now I have to go to the shower?
What?
This is some But then, what in the... Tacos and drinking games? Yes!
Okay, question for you guys just right off the bat. Let me know in the comments. Did you have a co-ed baby shower, or did you have a baby shower that was just for moms and for female relatives? I definitely like the inclusion of both, because I feel like female only is a little bit more like men stay in the waiting room smoking cigars while we're in labor. Like, men are much more active participants in pregnancy, in birth, as well as postpartum and helping to care for baby now. Thank the Lord that our partners are a little bit more involved in these things, as they should be, because they were involved in the creation. So yeah, I really like a co-ed baby shower.
Hey babe.
Yeah, babe?
Can you promise to keep it low key? I got 8 weeks to go and I'm always so sweaty.
Don't worry, Beau. I will handle everything for the shower.
Think you mean sprinkle?
What the hell's a sprinkle?
People think it's gauche to have more than one baby shower, so instead call it a sprinkle. It's a light rain instead of a downpour.
A sprinkle versus a baby shower. I've definitely heard that before. I've attended my fair share of sprinkles, and I guess for our second we did have a sprinkle, because you don't need everything again, right? But some diapers, maybe different gendered clothing or different seasoned clothing, and just reminding yourself that each baby is unique and special can be a great way to just have a little bit of fun with your family and friends.
She registered for 5 kinds of bouncy chairs? How much bouncing can one baby do?
And what is nipple butter? Unless it's exactly what it sounds like, I am in the dark.
It is exactly what it sounds like. Butter for your nipples. Well, like a soothing balm, really. Not like cow's milk butter.
Hey, I brought my gift early.
What kind of gift is an old, dingy baby pool?
Oh, not just any baby pool. Beau and I were born in it.
Come on, man. We cook our food here.
Okay, that's actually super gross. But fun fact, if you are having a home birth or even birth center, or some hospitals will have an inflatable pool, you can rent them, and you actually rent a liner to go in it, so that after the birth, you let the water out, you drain the water out, and then you take the liner out with all the goo and throw that away.
Hey, Pops, do you mind keeping an eye on the kids? I'm going to run Beau to the doctor real quick.
Yeah, I got a headache that won't go away. I just want to check it out before the shower.
Yeah, we'll be right back.
Okay, I love that Beau has a headache that won't go away, and she's also busy. She's got a shower coming, and instead of being like, I'm not going to worry about this right now, I'm going to push it off and put it off, she's like, nope, I made an appointment and I'm going to go see my doctor. Because a headache that won't go away with medicine, or a bad headache with vision changes, can both be signs of preeclampsia. And we'll chat a little bit more about preeclampsia in a second, because, spoiler alert, it does come up here.
Know that face the flight attendant makes when something's not right, but they can't tell you what? That's the face Beau's doctor had when she walked through that door.
Well, Rainbow, I'm glad you came in.
Oh my God, drink. It's okay, babe.
Okay, so let's talk about preeclampsia real fast. First of all, yay on Bo and Dre for going to the doctor and the doctor seeing them and not dismissing any of these concerns and checking her out and seeing, yes, this is preeclampsia. So what is preeclampsia? Preeclampsia is new onset hypertension, aka high blood pressure, after 20 weeks gestation with a combination of proteinuria, which is just protein in your urine, or any other features that show other organ involvement. So if your kidney labs are off, your liver labs are off, if you're having any issues with your lungs, if you're having those headaches, that's a severe feature, because what that can show us is that there's some neurological irritability happening with the preeclampsia. And the cause of preeclampsia is not 100% known. We know that there is some sort of perhaps genetic component to preeclampsia. We know that there is, of course, some sort of maybe autoimmune component of preeclampsia. We think it has something to do with when the placenta is developing and attaching to the inside of the wall of the uterus, that there is some sort of misfire or misattachment with the vasculature system there. And that kind of causes this cascade of issues. It is a very serious condition that often has no or little symptoms in the beginning that can evolve into more severe symptoms.
Turns out her headache and high blood pressure were symptoms of a very serious condition called preeclampsia.
What are some signs and symptoms of preeclampsia? So we talked about the high blood pressure and we talked about the proteinuria, that protein in your urine. Those are kind of silent signs of preeclampsia, which is where preeclampsia can be so insidious because you might have those issues and not know it unless you're going to your routine prenatal screenings. Most of the time we see preeclampsia at the end of pregnancy, so that's why those screenings pick up at the end of pregnancy, is to monitor for these issues that could be arising. Some other signs that things are more severe and also having multi-organ involvement would be that really, really bad headache, perhaps with vision changes. Those can all be signs of neurological involvement. Some people have really bad epigastric pain, which is pain right here. Maybe that wraps around to their back or up to their shoulders. That could be signs of some liver involvement, that liver is enlarged. Decreased urination can be a sign of kidney involvement. If we are feeling shortness of breath, maybe new onset anxiety, new onset nausea and vomiting can all be signs or symptoms, coupled with high blood pressure, that we are having some preeclampsia going on. And then another sign, but it's not diagnostic of preeclampsia, is actually really, really intense swelling. So a lot of times we see that swelling more in like the face, facial swelling, but all over body swelling. If you go from 1 week to the next and you've gained like 3 to 5 pounds and it's water weight, that's definitely something that we are concerned about, and we are going to be looking at your labs. We're going to be looking at your blood pressure to see if there is an underlying preeclampsia issue happening. Now, sometimes we might just have that high blood pressure and nothing else going on, and that's a condition called gestational hypertension. Sometimes that will develop into preeclampsia, or less severe preeclampsia will then develop into severe preeclampsia. So those are all things that we're going to keep a really close eye on. Again, why we see you so often at the end of your pregnancy.
I understand how preeclampsia can just come out of the blue. You don't think this happened because I put too much stress on you with all this stupid shower prep?
No, Dre, that's not how preeclampsia works. They don't know what causes it, but it's not related to stress. It has been linked to the age of the mother.
She is right. Stress definitely can exacerbate high blood pressure. We want to keep your stress levels down, particularly if you're admitted in the hospital with preeclampsia and high blood pressure. We want to keep the lights low and dim and all of those things. That can also reduce the risk of having a seizure in the hospital. But I do want to go over what some risk factors of preeclampsia are. So, nulliparity, aka it's your first baby. If you have multiple fetal gestation, like if you're having twins, triplets, etc., 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 and that we think is because with more placentas, bigger placenta, if they're sharing a placenta, we have more issues with the placenta being the cause of preeclampsia. Being over the age of 35, having gestational diabetes or pre-existing diabetes, having antiphospholipid syndrome, having a pre-pregnancy BMI of greater than 30, having gone through assisted reproductive technology. IVF is a risk factor for preeclampsia. Typically, again, because of how that placenta is attaching is what we think there. Kidney disease can also be a factor, as well as a history of obstructive sleep apnea. Some other risk factors that are not direct causes, but because of the racism and biases in our system, are being Black and also being of lower socioeconomic status. Again, those aren't causes of preeclampsia, but they are risk factors of slipping through the cracks of our system.
I'm afraid the drugs aren't bringing down your blood pressure. I think we may have to induce.
What? Why?
Because the only thing that's going to help now is delivering the baby.
But now?
Yeah.
He's not due for another 2 months.
It's okay. It's gonna be fine. We deliver babies early all the time at this hospital. It's totally fine. So let's just get this little out. I'm sorry. I'm trying to stay positive, okay? I overshot it a little bit.
Okay. So let's talk about what they're saying here, right? What are the treatments for preeclampsia? The best treatment depends on how severe your features are, where you are gestationally, what's going on. Now, one thing that we might consider doing if we know that you're at a higher risk for preeclampsia is starting a low-dose baby aspirin around 12 weeks in your pregnancy. And what this can do is it might make that preeclampsia take longer to develop. It also can reduce the risk of severe preeclampsia, fetal growth restriction that can occur with the preeclampsia. The treatment for preeclampsia is going to be multifaceted. So if you have preeclampsia with non-severe features, delivery at about 37 weeks is recommended. If your blood pressure is just elevated without any preeclamptic features, delivery at about 39 weeks is recommended. If your blood pressure is elevated with severe features, ideally we want to get you to about 34 weeks. But if we can't control those severe features, like those high range blood pressures that Bo's doctor is talking about, then we would consider induction or cesarean birth earlier than that. The other thing that we're going to do is we will give you something called magnesium sulfate, which is a drug that is going to relax some smooth muscle and also lower your seizure threshold. So it's going to make you feel really hot, pretty uncomfortable, a little woozy, a little bit out of it is really normal. It also will help a little bit bring down the blood pressures, but that's not the goal. The goal is to bring up your seizure threshold so that you're less likely to develop eclampsia, which is when we have a seizure with preeclampsia. The other thing your providers are going to be doing is trying to manage your blood pressure and getting them out of the severe range. You want to bring them down so that we're not at a range where a stroke is a possibility too. See how multifaceted this is? The other thing that we're going to be doing is giving you a dose or two of steroids. And these steroids will help with your baby's lung maturation. So those are kind of all the things that we're going to be doing. If you come in with a diagnosis of preeclampsia with severe features, there might be a lot of things going on at once, and that can feel really, really stressful.
And Agnew,
Don't try to tell me how to live, boy.
Pops, Bo has something called preeclampsia, which means the baby has to be delivered today.
Bo in the background looking at her
kids busy,
chart.
all right?
So me.
I don't want to scare her.
I can do that. That was your daddy. He wanted me to pretend that everything is okay, but it's not. Your mama has a serious medical condition.
Hey, man, is there a vending machine?
Oh, yeah.
What the hell?
Everybody in the waiting room. Now, if you have preeclampsia, even if visitor policy is back open in your hospital, I really encourage you to keep visitors, especially visitors that are going to stress you out and bring up your blood pressure, out of the room. We want lights dim. We want quiet, hushed voices, similar to in labor. We want you to be able to relax and rest and help bring those blood pressures down too. Stress is not going to cause preeclampsia, but significant stress is not going to help it in the moment either.
So the doctor told me Bo's blood pressure was so high that inducing was too dangerous, and they had to do an emergency C-section. It was all happening so fast.
Yeah, so like I said, with those blood pressures being in a super severe range, at 32 weeks an induction might take a little bit too long, and so this is shared decision making. Hopefully this doctor's also already talked to Bo. I'm sure she has. Bo is also a physician at this facility, so I'm sure they've had a conversation about, hey, this is the best course of action to get baby here as safely as possible, and also to get you not pregnant as safely as possible. But I cannot discount how stressful this is for partners in this situation. It feels totally blindsided.
Show me my chart. No. I don't want the generic stuff. I want the uncut dilaudid. Give me what we'd give Jennifer Lawrence if she was having a baby. See what I can do. Thank you.
Okay, this again, super funny. We're not gonna be giving you narcotics or things that can affect the baby when you're still pregnant. Bo here has a spinal, which means that they were able to put medication in her spinal space to make her numb, and they will be using that until the baby's born. And then of course, if there's pain, discomfort after that, we can definitely give you narcotics, but we're not gonna be giving you narcotics right at birth. Now, one thing that can happen with preeclampsia is sometimes you can develop something called HELP syndrome as well, where your platelets drop. And in that case, general anesthesia is going to be what's used. You're going to be put to sleep for delivery as opposed to being awake with a spinal. So there's a little bit of a difference there, but it looks like Bose has not developed into HELLP syndrome. Thankfully, that is a whole nother can of worms. That is a whole nother can of worms that is pretty scary.
We're having our baby.
Okay.
Okay.
I'm here, babe.
This is normal.
Okay.
This is normal. Mm-hmm. Yep, this is normal. It's normal, babe. Okay, this is not normal.
It's okay.
No, it's not normal, Trey. I'm really scared. I'm scared, Trey.
It's scary. It's scary.
This was not supposed to happen like this. I'm really good at this stuff. I'm a baby maker. Oh, Trey, what if something goes wrong?
Hey, stop. Okay, stop. Okay, look at me. All right? You don't have to say those things because you're not going anywhere.
Okay.
All right, you are a warrior.
Okay.
All right, and you're going to get through this just like you get through everything else with grace, with strength, maybe with great hair.
I am such great hair.
Yes, you do. You got this, okay?
Okay.
All right.
I got this. I love you, Trey.
It is scary when things don't go no. God. It is so scary when things don't go to plan. This is Bo's 5th pregnancy. This was not what she was expecting. A 32-week delivery with preeclampsia is intense and scary. He is saying all of the right things. It's really hard, and I hope that Bo has someone to talk with this about afterwards, because this is potentially traumatic situation. And if this has happened to you, like, just know that I get that it's scary, and I am your support team. We are there to do everything we can to make it seem less scary, but it's still scary, and I totally understand that. So it's scary for her, and she's a doctor, and she knows what's happening. It can be hard, and it can be really hard to give up on the dreams and the expectations of the birth and the delivery that you were hoping for, and the term baby that you were expecting. It's a lot.
Okay, but final stretch.
Okay.
You're going to feel a little tugging.
Hey, babe. You're doing great.
Okay.
And we have a baby boy.
Oh, God.
He's
Oh, my
gorgeous.
God. I can see him.
He's here, babe. He's here.
Dave.
So Bo said, oh, I can't see him. Ask at your facility if they have a clear drape so that you can see the birth of your baby. It is a wonderful, wonderful thing that we offer at ours. So we actually drop down that blue drape. There's a clear drape so that you can see the birth of your baby a little bit more clearly. Because we want you to have that connection. Immediately, you shouldn't be the last one to see your baby here.
He looks like a baby. He does. Yeah, very tiny, fragile baby. Yeah. But where are they taking him?
They need to get him down to the NICU to run some tests.
But everybody said he was going to be fine.
Well, he's premature, which means his lungs aren't fully developed.
Lungs?
We don't want to risk infection.
Okay, Dre, you need to go with the baby.
Often at 32, 34 weeks, baby might need a little bit of extra respiratory support. Hopefully they're able to come and give you a kiss before going to the NICU, and then your partner can stay with you or go with baby to the NICU, whatever seems best and right for the two of you guys at the moment to make that decision.
If it were true that the plane wasn't going down and everything was going to be okay, why were the flight attendants putting on parachutes?
I actually super appreciate that we are seeing this from Dre's perspective, because it's not a perspective that I think about as much as a labor nurse, and how scary and how overwhelming all of this is for your support person, for your partner. I'm always thinking about my patient and their baby, and I think about the partner too, but this has definitely caused me to think even a little bit more about them.
How you feeling, sweetie?
I'm really tired, but I'm okay.
So I will say it can be really, really difficult if you've got preeclampsia, you're still in the magnesium after baby's born, and they're in the NICU. For you to get down there to the NICU, you are going to have to come up with a plan to get down there, and it might not be for a little bit of time. So it's great if your partner can go down and do skin to skin. That's going to be beneficial for baby and for your partner as well. It's also great if we can get you hand expressing and pumping in those first few hours after birth, as long as you're medically stable to do so if your goal is to breastfeed.
What if I fall in love with that baby and he breaks my heart?
Look, I can't guarantee you everything's gonna be all right. No one can. But I can promise you this. If you don't get in there and spend every moment you can with him right now, you will regret it.
The strongest out of all
Look
of
at
us.
that baby. That's
Especially
not what a
Dad.
32-week
He's
baby
weak.
looks like.
He
That's a really
cries
chunky
all
little
the
baby.
time. We
But he's
can't wait
so
to get you
sweet.
home and play with
So he
you
has
and
those
hug
needs on
you
him.
and kiss
That's
you.
super normal.
You coming early just means we have more time to spend together. Love, Diane.
I see an IV line and a pulse ox on the hand. That might be on the foot as well. Some other things that you might see is a little bit of respiratory support, maybe some oxygen, maybe even like a little helmet called an oxy hood, or some CPAP, which is some positive pressure to help open up those lungs or airway. Often they develop a little bit of jaundice, so that you might even see like a little light, and in that case they'd have a little eye covering over their eyes. And often in an incubator, that is helping to keep them warm.
Guys, Devontae's here. Your mom's feeling better. I thought this was a party. Where's the music?
I'm on it.
Probably don't have a DJ
I just love
postpartum,
co-ed baby showers.
but I love this for them. Okay, so that was the episode. Great show. A really good depiction of some of the emotional struggles, of some of the symptoms that we might see with preeclampsia. I thought that that was pretty accurate, all things considering, TV show wise. Let me know what you think. Let me know if you have any recommendations for other TV shows or movies you'd love for me to react to. And if you had a birth similar to Beau's or preeclampsia or anything like that and you want to chat with me about it in the comments, definitely do so. Until next time. Bye guys.